Namaste Vidya.
Namaste sir.
A very good morning to you all. Myself JV Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH, University, Jaipur. In the last lecture, we had discussed about osteoarthritis. We have discussed osteoarthritis in detail. We have discussed osteoarthritis in every aspect regarding its definition, pathophysiology, what are the predisposing factors, clinical features, investigations, and management. In today's lecture, we are going to discuss another important disease that is related to the locomotor system. It is rheumatoid arthritis. Osteoarthritis was basically a non-inflammatory disease that we have discussed, and rheumatoid arthritis, in comparison to osteoarthritis, is an inflammatory disease. So, what are the common signs of inflammation? You all know the signs of inflammation. What are the signs in second year pathology?
Redness, swelling,
swelling,
pain,
can we elaborate these 5 points?
rubor tumor,
And functional defect. So, rubor is
redness,
tumor is
swelling,
B is
pain,
and C is
warm,
temperature, yellow. Alright. F is loss of function. So all these 5 features will be found in case of rheumatoid arthritis. Alright. Osteoarthritis was basically a non-inflammatory disease, and in rheumatoid arthritis you will find inflammation present in the joints. There will be more destruction in rheumatoid arthritis in comparison to osteoarthritis. Osteoarthritis was affecting which age group? Alright, it was uncommon below 40 years of age, and rheumatoid arthritis will be seen in comparatively younger age. Alright, we are going to see the patients of rheumatoid arthritis, and this disease will be affecting a comparatively younger age group. Osteoarthritis was affecting which joints? And which was the most common joint that was affected? What was the basic predisposing factor for the development of osteoarthritis? Trauma affecting how many joints? One joint. And after one joint, then other joints were affected. Whereas in rheumatoid arthritis, we are going to discuss what are the etiological factors, what are the changes that are happening in the joints. Alright. So first of all, what is rheumatoid arthritis? Let's start the journey with rheumatoid arthritis. This is again a chronic inflammatory disease of the joints. Alright. It affects what kind of joints? Small joints and bilaterally symmetrical joints. Alright. It is a chronic inflammatory disease of unknown etiology. The cause of rheumatoid arthritis is not known. Basically, it is an autoimmune disease. What is an autoimmune disease? What do you understand by autoimmune disease, beta? When your immune system is fighting against your own cells. Alright. Normally, what does the immune system does in a healthy individual? Fights against the infectious agents. Alright. The immune system fights against all the harmful substances or agents that are affecting the body. But in autoimmune disease, the cells of the body are destroyed by its own immune system. So rheumatoid arthritis is basically an autoimmune disease in which the cells of the body are being destroyed by the self-immune system. Rheumatoid arthritis was affecting only joints. Only joints were affected in rheumatoid osteoarthritis. In osteoarthritis, only joints were affected, whereas in rheumatoid arthritis,
multiple systems are.
we have 2 types of involvement. We have articular involvement, that is joint involvement, as well as extra articular manifestations, in which what will be affected? Skin will be affected. You will be finding nodules, heart, lungs, alright. So multiple organs will be affected in the case of rheumatoid arthritis. So this is a more severe disease which is going to affect a lot of things. So it is the most common form of chronic inflammatory arthritis, often resulting in joint damage and physical disability. So the degree of disability is more in case of rheumatoid arthritis, alright, in comparison to the osteoarthritis. This affects early in age group, and hence the damage that is rheumatoid arthritis is going to do in an individual is more vast and more severe. It is a chronic multi-system disease of unknown etiology. So it is not only involving the joints but also other systems of the body. This is of unknown etiology. It is characterized by persistent inflammatory synovitis. What is synovitis?
Inflammation of the synovial membrane.
Very good. Inflammation of the synovial membrane. So you will find synovitis persistent. The inflammation will be persistent, whereas the inflammation was absent in case of osteoarthritis. So we will get persistent inflammatory synovitis usually involving peripheral joints symmetrically. So the peripheral joints will be involved and symmetrical involvement of the joint is seen. It is characterized by cartilaginous destruction, bone erosion and joint deformity. So cartilage loss was also present in osteoarthritis. But what kind of cartilage loss was there? Focal. Localized focal cartilage loss was there. But in case of rheumatoid arthritis, there is general destruction of the cartilage. Alright, apart from the cartilage, the bone is getting destroyed, bone is getting eroded, and the surface of the bone, both the bones are getting fused together. And due to which there is deformity in the joint. So these, can you see this? Can you see this picture? This is the normal joint, alright. This is the cartilage joint capsule, and we have the bones. And what is seen in the rheumatoid arthritis? There is inflammation. Can you see the red color?
Yes.
Red color represents the inflammation in the particular joint. Alright?
Yes, sir.
So, peripheral joints are involved, smaller joints are involved, and bilaterally symmetrical joints are involved in case of rheumatoid arthritis. So, we have the involvement of smaller joints, alright? Smaller joints of the hand. So, all these joints are getting involved. Now, what is the course of disease? How does the disease progress? Alright? So, course of disease is very important to understand the diagnosis and ultimately understand the disease in order to treat the disease and prevent the progress of the disease. So, the clinical course is prolonged. Since the disease is occurring in a very younger age, hence the disease progress is prolonged with intermittent exacerbation and remission. What is the meaning of intermittent exacerbation and remission? Exacerbation and remission. Remission means exacerbation and remission. What does it mean? It means sometimes the symptoms are very severe and at some time the patient is free from the symptoms. Alright? This happens. Sometimes the disease is very severe, sometimes the symptoms are very severe, and on the contrary, at some times the symptoms are totally absent in the particular patient and the patient is free from symptoms. The patient with RA have an increased mortality. So because of the involvement of many systems, not only the joints, but also other important vital systems like heart, lungs, skin, the mortality rate is very high in case of rheumatoid arthritis. This is increased when compared to the age-matched controls. That means if we are taking two patients, we are having two individuals, both of 50 years of age, and one is suffering from rheumatoid arthritis and other is not suffering from rheumatoid arthritis, that is acting as control. So the patient with rheumatoid arthritis is having more chances of mortality or death due to rheumatoid arthritis. So the chances are more in an individual in comparison to the same age group individual who is not having rheumatoid arthritis. RA patients are registered disabled within 3 years. So, if we are talking about the severity of the rheumatoid arthritis, these are registered disabled within 3 years. The patient becomes disabled within 3 years. In around 80% are moderately to severe disabled within 20 years. Means if we are talking about rheumatoid arthritis, what is the prognosis of the disease? How the disease will progress? So, within 3 years, RA patients will become disabled. Around 80% are moderately to severely disabled within 20 years, and 20% 75% will require joint replacement because the tenure, the disease progress will be taking lot of time. So, lot of patients will be disabled, lot of patients will have deaths because of the extra-articular manifestation. This is basically the data that how much patients who are suffering from rheumatoid arthritis, what will be the outcome of the particular disease. So, functional capacity decreases most rapidly at the beginning of the disease. So, initially when the patient is suffering from the disease, the functional capacity decreases. If you are having pain, if you are having deformity, if you are having any other involvement, then you are not able to function properly. Alright, so the functional capacity, as soon as the disease develops, your functional capacity decreases considerably. And the patient will be disabled, there will be great mortality rate, and ultimately the patient will be requiring joint replacement. Now, what is the incidence of the disease? This is very important for you. What is the incidence? It only affects 0.5 to 1% of the population. The incidence rate is very, very low. But if we are talking about the total population, then also this 0.5 to 1% is a very significant number that is affecting the total population. So it affects only 0.5 to 1% of the population. Women's, we have also seen in osteoarthritis, females were more prone for developing osteoarthritis. In the similar way, RA is also common in females. What is the ratio? If 3 females are getting affected, then only 1 male in comparison to 3 females is getting affected. The incidence of RA increases between 25 to 55 years of age. So most common age group that is getting affected by RA is 22 to 25 to 55 years of age. In comparison to osteoarthritis, which was developing later in age group. Below 40, we were not even expecting osteoarthritis to occur. But if a patient is coming to you in a younger age group with joint pains, alright, then you, and with a symmetrical involvement of the joint, then it will be very prone that a particular patient is having rheumatoid arthritis. Alright, so always take it seriously. What are the different factors that are responsible for development of rheumatoid arthritis? We have genetic factors and environmental factors. Association of the gene, it's HLA-DR4 gene that is more commonly associated with rheumatoid arthritis. Cigarette smoking is very important factor. If you are smoking, if a patient is coming to you and with joint complaints, you always ask for the history of smoking. And you always advise the patient to stop smoking if the patient wants to stop the progress of the disease. Because cigarette smoking is having a very important relation in case of rheumatoid arthritis. It can be triggered by various kinds of infectious agents. Alright. So there are various infections which can trigger the onset of rheumatoid arthritis. So what is the incidence factor? It affects what population? 0.5 to 10%. What is the age group that is most common?
25 to 55 years.
25 to 55 years of age group. Alright. And here it is written after which it plateaus. Means after 55 years of age, the progression plateaus, the rate does not increase. And after 75 years of age, this is very uncommon. And then decreases. Osteoarthritis range, the chances for development of osteoarthritis was increasing with age. Whereas the chances for development of rheumatoid arthritis is decreasing with age. It is maximum, the maximum chances are between age group of 25 to 55 years of age, then becomes standstill and then after 75 it decreases. Alright. Now, what is the etiology? Alright, etiology and pathophysiology. What are the causative factors? The exact cause is unknown. We have already discussed this thing. What is the cause of development of rheumatoid arthritis? It is basically an autoimmune disease. Now we will be trying to understand the pathophysiology. What is going on in the joints in case of rheumatoid arthritis in order to understand the complete picture of rheumatoid arthritis. You will see a lot of destruction in the joint structures in case of rheumatoid arthritis. We have seen the picture of joint in osteoarthritis. You all know about the structure of the joint. The joint contains a cartilage, the joint capsule and the bones. Alright. So there will be great swelling, alright, in the synovial membrane. There will be inflammation, alright, great inflammation, and due to the inflammation there will be infiltration of the cells. It is an autoimmune disease. So our own immune system will act against the cells it will destroy the cartilage, completely destroy the cartilage. There will be erosion of the bone. The joints, what are the bones? Suppose if we are talking about the knee joint. So, what are the bones that are present in the knee joint? So, femur is directly attached to tibia or fibula? Fibula is a weight-bearing bone. So, femur is attached to the tibia directly. So, what will happen in case of rheumatoid arthritis? There will be inflammation of the synovial membrane. With the inflammation, there will be formation of pannus. This is an important term in case of pannus formation. This is the characteristic feature of rheumatoid arthritis. This term you have to remember. Pannus formation. What is pannus formation? There is granulation tissue formation. Alright? In autoimmune disease, this will come in the PPT, but I don't write it. Just first of all understand this thing. Alright? I will give you this PPT. You already have this in your portal. So, there will be involvement of the T cells because this is an autoimmune disease. So, there will be involvement of the immune system. The immune system will consist of the T cells, B cells, lymphocytes, macrophages. Alright. So, these cells will be involved. Apart from this, you have to remember the name of two things. Number one is, have you heard about it? Rheumatoid factor, which is very useful in the diagnosis of rheumatoid arthritis. Okay. And the second one is, have you heard of it? Anti-CCP antibodies? Alright, this will come later on in today's lecture as well. So you have to remember few terms. Whenever you are studying rheumatoid arthritis, then you have to remember few things. One is RF factor. Alright, the names of the inflammatory cells. We have T cells, B cells, lymphocytes, macrophages. All these are coming together, leading to the formation of pannus. Alright, pannus is basically leading to the formation of a granulation tissue. This is a characteristic feature of rheumatoid arthritis. This will lead to the destruction of the cartilage. The cartilage is totally getting destroyed. Suppose this is a joint. Alright, these are two bones. And in between we have a cartilage. Alright, and this is the joint capsule. So what happens in rheumatoid arthritis is, this synovial membrane, you will find inflammation. You will find redness, inflammation in the synovial membrane. You will find inflammation of the joint. The joint is red and inflamed. There will be presence of all these cells, T cell, B cell, lymphocyte. All this will lead to the formation of pannus. Alright, then what will happen? This cartilage will get eroded. There will be erosion, there will be destruction of the cartilage and the erosion of the bony surfaces. So, if the cartilage will be destroyed, both the ends of the bone will come together. Alright, this also happened in osteoarthritis. There was narrowness in the joint space. But then what will happen? There will be erosion of the bone. So due to the erosion of the bone ends will get eroded. The bones have come closer, the ends have got eroded. So ultimately what will happen? There will be fusion of the bony surfaces. So both the bones will ultimately fuse, leading to the non-mobile joint. The joint will be deformed and they will become non-mobile because the ends are fused together. So this is the main pathophysiology that is happening in case of rheumatoid arthritis. Alright, this we are going to discuss now. Alright, so it is characterized by persistent cellular activation or autoimmunity and the presence of immune complexes. Since this is an autoimmune disease, so there will be presence of autoimmune immune complexes at the sites of articular and extra-articular lesions. So we will be talking about two types of lesions, articular and extra-articular. Articular will be pertaining to joints and extra-articular will be pertaining to other than joint. Alright, the different other vital organs that we are going to discuss. This leads to chronic inflammation, granuloma formation and joint destruction. Granuloma formation is basically pannus formation. Alright. Earliest signs change is swelling and congestion of the synovial membrane. So what will happen? There will be swelling and congestion of the synovial membrane. The synovial membrane will be swollen and congested because this is an inflammatory disease. On the contrary, osteoarthritis was a non-inflammatory disease. Alright? And underlying connective tissue. So there will be inflammation, there will be swelling of the connective tissue and the synovial membrane. It is characterized by infiltration of the synovial membrane with lymphocytes, plasma cells and macrophages. So the cells will infiltrate because this is an autoimmune disease. So the cells, our autoimmune cells will come down and try to destroy our own surfaces. Now this is what happens. This is a healthy joint. This is inflamed. This is the synovial joint. There is great inflammation and infiltration of the cells, due to which the swollen inflamed synovial membrane, the cartilage is getting destroyed and there is reduced joint space that is happening. Alright, inflammation is a key feature for rheumatoid arthritis, whereas in osteoarthritis inflammation was not present. Now what happens is activated T cells. We have T cells, we have B cells. So due to the autoimmunity, the T cells are getting activated and in response they are activating the B cells. Alright, so B cells to produce immunoglobulin. Different type of immunoglobulins are produced by the B cells. One of the immunoglobulin is RF, that is rheumatoid factor, that helps you to diagnose the case of rheumatoid arthritis. For diagnosis of rheumatoid arthritis, you always go for the rheumatoid factor test. Alright, the diagnosis is incomplete if this factor is absent. Alright, you cannot diagnose the case of rheumatoid arthritis. And macrophages to produce pro-inflammatory cytokinins. So cytokinins are produced. Cytokinins are produced in response to the inflammatory changes that are happening in the body. It acts on the endothelium, synovial fibroblast. These are the structures of the joints on which these cells are acting. So it acts on the endothelium, synovial fibroblast, bone cells and chondrocytes to promote swelling and congestion of the synovial membrane. So this is leading to the swelling and congestion of the synovial membrane and destruction of the bones, cartilage and soft tissue. So what is happening? Ultimately the joint structure is getting destroyed. There is inflammation of the synovial membrane, the cartilage is getting destroyed, the bone is getting eroded and the soft tissue is also getting destroyed. The B cells release immunoglobulins including rheumatoid factor which can form immune complex leading to the vasculitis. What is vasculitis? Very good. Very good. So lymphoid follicles from within the synovial membrane are formed. Now this is basically the pathophysiology that is happening. This is the normal joint, alright, and these are the changes that are happening in the joint. So there is erosion of the bone, callus formation. Callus formation is basically the granulation tissue. There are T cells, there are plasma cells, there are neutrophils, B cells, and hyperplastic synovial membrane. Alright, so all these things are basically eroding the joint, destroying the joints, destroying the cartilage, bones, and the other structures of the joint. Now, inflammatory granulation tissue, that is the pannus. Always write about pannus if it is asked about rheumatoid arthritis. If you don't write pannus, that means you don't know anything about rheumatoid arthritis. Alright, pannus spreads over under the articular cartilage, which is progressively eroded and destroyed. So the cartilage is basically getting eroded and destroyed. Fibrous or bony ankylosis can occur. So there can be fibrosis. Bony ankylosis is basically bony fusion of the two bone surfaces. Muscles adjacent to the inflamed joints atrophy. So the muscles that are near to the joint are getting atrophied and infiltrated with lymphocytes. Because this is an autoimmune disease, so infiltration of the lymphocytes usually occurs. That is the B cells. Alright? B lymphocytes. Rheumatoid nodules. There are certain nodules that are known as the rheumatoid nodules. Alright? These consist of a central area of fibrinoid material. Rheumatoid nodules are also present in case of rheumatoid arthritis. I will show you the figure. And what is present in the rheumatoid nodule? It consists of a central area of fibrinoid material that is surrounded by the palisade of proliferating mononuclear cells. So the rheumatoid nodules will also show the signs of inflammation. There will be central fibrosis, fibrinoid material, and that will be surrounded by the palisade of proliferating mononuclear cells. These are basically immune cells. These are the rheumatoid nodules. Just by looking at these nodules, you can diagnose the case of rheumatoid arthritis. We have also seen two types of nodes in case of osteoarthritis. What was the name of those nodes? Haberdens nodes and Boucher nodes. So, Haberdens nodes were present in which joint?
Distal.
And Boucher nodes? And these are the rheumatoid nodules. Can you see the rheumatoid nodules? It consists of central fibrinoid material surrounded by the palisade of proliferating Now, the extra-articular lesion. What is the pathophysiology of the extra-articular lesion? The extra-articular lesion can occur in the pleura of the lung, pericardium and sclera. I have already told you that this is a disease not only affecting the joints but also extra-articular features like extra-articular organs like lungs, heart and skin and also sclera. Lymph nodes are often hypoplastic. There is hypoplasticity of the lymph nodes showing many lymphoid follicles. So, lot of lymphoid follicles are seen in case of the lymph nodes. There is immunofluorescence which confirms rheumatoid factor antibody. So, by doing immunofluorescence test, we can confirm the presence of rheumatoid factor antibody, synthesis in the plasma cells in synovium and the lymph nodes. So, this is basically done for the diagnosis of a disease. Now, these are the various extra-articular features. I am not going to discuss here in this slide, but we are going to discuss the extra-articular feature one by one of each and every organ. But we should know where the extra-articular features are coming from. This is the elbow, splinter hemorrhage. There will be lymphadenopathies. There are the extra-articular features in the feet. It will affect the lungs, pleura, eyes, sclera, kidneys, and heart. So these are the various organs in which you will also find extra-articular features. Alright. So it is not only rheumatoid arthritis is not only affecting the joints, but also affecting extra-articular sites like heart, lungs, liver, kidneys, etc. Now this is the stage, the pathophysiology we have already studied, and we are going to see it diagrammatically what are the different changes that are occurring in case of rheumatoid arthritis. So this is the normal joint. First of all, this is the normal joint which is showing bones and cartilage. We have fibrous capsule, synovial membrane. We have the joint cavity with synovial fluid. So first one is the normal joint. Then in the second stage, we are getting inflammation. Can you see the red color? Red color always represents the inflammation. So the synovial membrane is inflamed and thickened, and bones and cartilage are gradually eroded because of the infiltration of the plasma cells, macrophages, lymphocytes, etc. and callus formation. So as the disease progresses, there is the formation of callus formation, and there is excessive destruction of the cartilage and erosion of the bone. So due to the destruction of the cartilage, the bone surfaces are getting closer, and also there is erosion of the bone. As the disease progresses, there is fibrous ankylosis, means fusion of these two bones. The joint is involved by fibrous connective tissue. So first of all, there is formation of fibrous connective tissue, and then ossification occurs in this fibrous connective tissue, removal of fusion of the bone. Ultimately, the bone is fused, and the joint is replaced by a straight bone. Hence, there will be lack of movement of that particular joint. So these are the 5 stages that are happening. First of all, we have the normal joint. Then the stages, first of all, inflammation, callus formation, fibrocartilage formation, and bony fusion. Now, what is the difference between the rheumatoid arthritis and osteoarthritis? We have already studied osteoarthritis, and now it's time to compare the symptoms, few symptoms of osteoarthritis with rheumatoid arthritis in order to understand it completely. Hallmark of rheumatoid arthritis includes cartilaginous destruction. Alright, there is destruction of cartilage in case of rheumatoid arthritis, whereas in osteoarthritis there was
focal loss of articular height.
There are bony erosions in case of rheumatoid arthritis, whereas in osteoarthritis there was
Qualification of new
bone. There was continuous proliferation of the new bones, which was leading to the formation of osteocytes, which was typical feature of osteoarthritis. There are joint deformity. Alright, there is remodeling of the joint count. In osteoarthritis, there was remodeling of the joint count. And in case of osteoarthritis, in the blood investigation, we were not finding anything. Alright, all the values of inflammation was normal. ESR was normal, C-reactive protein was normal. Whereas in case of rheumatoid arthritis, we will find rheumatoid factor antibodies present, cytokinins present, and the signs of inflammation like ESR will be raised, alright, C-reactive protein will be raised, and all these things will be raised because of the inflammation present in case of rheumatoid arthritis. So this is again the difference in the joints. Normal joint we have bursa, muscles, tendons, bones, synovial membrane, synovial fluid, joint capsule and cartilage. In osteoarthritis, we see the bones and grafts together then cartilage. Whereas there is inflammation in case of rheumatoid arthritis. So this was all for today. In the next lecture, we are going to discuss the clinical features of the rheumatoid arthritis. Alright, have you understood the lecture today?
Yes, sir.
So this session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with the digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much.